The body does change after having a baby. Each woman is unique, so there's no one version of normal. The normal is going to be different for everybody. The areas of the body that will change after having a baby will definitely be skin and hair, your abdominal muscles, your breast, as well as your uterus. Your body does produce more of a pigment in pregnancy called melanin, and this is why women will have darkening of the skin on the cheeks, also in the midline, under the belly button, and then stretch marks can come into play as well. Your hair is gonna grow a lot during pregnancy. However, postpartum, within a few months, it will start to shed. As you're growing the pregnancy, your muscles start to separate in the midline due to the distension of your uterus and the stomach. And postpartum, there still remains a little bit of separation in a lot of women. Sometimes it goes back to normal, and then in some women it won't. So for treatment, we would recommend core exercises, and then down the road, there's other treatments for that as well. We do see problems with just general pain in the pelvis, sometimes urinary leakage, and pain with intercourse as well. So to make the pelvic floor muscles better, the first recommendation is going to be to try Kegel exercises. When your bladder's empty, you squeeze your muscles of your bladder, including your sphincter, and you have to do many reps of those to see improvement. And then the next step would be physical therapy for the pelvic floor. There are some changes to the breast during pregnancy and postpartum. When you're pregnant, you have higher estrogen levels. That is stimulating blood flow to the breast tissue. So immediately, pregnant women will feel that their breasts are enlarged and swollen and tender. And then postpartum, the breasts are primed for milk. So to help with comfort during the breastfeeding time, we would recommend a supportive bra. One big thing is weight gain, which every woman feels in some form or another, and you can feel that in your hips, your waist size, pressure in your pelvis, your feet can enlarge. You might have to buy pregnancy clothes. I think the key is giving yourself time to feel better and recover, whether you had a vaginal delivery or a C-section, and then you want to start back exercise gradually and work up to a harder fitness level. You can walk your baby in the stroller. That's good time to get outside and also spend time with your baby. Swimming is a great exercise, and then yoga, any way that you stay active. And then nutrition is also super important. So you want to eat healthy, fruits, vegetables, lots of water. Those two are going to be the biggest parts of losing your baby weight. As a mother of three, I'm reminded each time I have a child of the challenges that we all face being postpartum, but I'm also reminded that there's no other experience like it. It is the most wonderful and joyful time, sometimes of your whole life. We want you to know that you're not alone. You can reach out to us, give us a call, whether that's your medical team, family, friends. So I want you to lean into the moment and enjoy this season of your life.